Hello everyone, welcome to our Medical Brain YouTube channel. So in this session we are going to discuss about the renal function test. So what is meant by the renal function test? So the renal function test is done for the normal functioning of the kidneys, okay, whether the kidneys are functioning properly or not. So mainly there are four groups or the four classification for the renal function test. So first one is the urine examination and the second one is the GFR, that is glomerular filtration rate, and the third one is the analysis of the blood or the serum, and the fourth one is the tubular function test. Okay, so in this urine examination there are two types, that is the physical examination and the biochemical examination. So in physical examination what we do is we collect the urine sample and we detect the color and the odor and other physical parameters, and in the second, that is the biochemical examination, we detect the glucose and ketones, etc. Then coming to the analysis of blood or serum, in this test we are going to test for the electrolytes such as the sodium and the potassium, and in the fourth, that is the tubular function test, in this test we are to test, that is the concentration test and the dilution test. So in this session we are going to focus only on the GFR, that is glomerular filtration rate. So to check the proper functioning of the glomerular filtration rate, there is a test called as the clearance test. So this clearance test is nothing but the volume of the plasma from which the substance is completely cleared by the kidneys per minute. So this is called as the clearance. Okay. So in clearance test we mainly use the three substances, that is inulin, creatinine and the urea. Okay. On which basis we are going to select these substances is they must be freely filtered and they should not be secreted or reabsorbed. Okay. So first one is the inulin. So inulin, it is neither reabsorbed or the secreted. It is filtered freely. Okay. So next it is given intravenously. So this is one of the disadvantage of this inulin, and the normal value of inulin is 120 ml per minute. Okay, and the second one is creatinine. So this creatinine, which is freely filtered and there is no reabsorption, and it is already present in our body and there is no necessary to give it intravenously, and the normal value of creatinine is 90 to 120 ml per minute. And coming to the third one, that is urea. Urea is the end product of the protein metabolism. So when the protein will digest, the end part of the protein metabolism is called as a urea. So this urea is not secreted and neither reabsorbed. So the normal value of urea is 120 ml per minute. And in this one, the main important thing is, in this the inulin and the creatinine is not affected by the protein diet, but whereas the urea is affected by the protein diet. And one thing is, the glomerular filtration rate value is 125 ml per minute. So next we will see the formula for the calculation of the clearance test. So the formula for the clearance test, that is especially for the creatinine clearance, is U into V divided by P, where U is the urine concentration of creatinine in mg per deciliter and V is the volume of urine in ml per minute, and the P is the plasma concentration of creatinine in mg per deciliter. So from these values or the values obtained here, we should put in this formula to obtain the clearance, creatinine clearance. This is the complete information of the renal function test along with the formula at the last step. So for more information, please subscribe our YouTube channel, and thank you for watching.